Hello everyone. This is going to be part 4 of my web series about my experience of having osteosarcoma. Once again, I have a small script or outline. Um, so to begin, I started the second half of chemotherapy on June 12th of this year. I had a lot of anxieties about starting again, mostly about just how it made me feel and being sick and all that. Um, because of my tumor necrosis, my drug regimen was changed, so I was no longer going to be taking cisplatin, and it would be substituted for a new drug called ifosfamide. So I wound up doing 6 sessions of chemotherapy this time instead of 5. The first 2 were with doxorubicin and ifosfamide together. Then I had 2 sessions of methotrexate back to back, and then they took me off of doxorubicin, and I had 2 sessions of ifosfamide by itself. So luckily, I didn't really have any side effects this time, in terms of like nausea and vomiting. And because I was off of cisplatin, I wouldn't be having any further issues with tinnitus or peripheral neuropathy. I'm still dealing with both of those things. I have tinnitus pretty much 24/7, and the neuropathy is also pretty much 24/7. But because they took me off of cisplatin, those things would not get any worse. So in terms of side effects, I would say the worst of it was just what ifosfamide does to you. They told me that in a very small percentage of patients, ifosfamide can cause basically like delusional amnesia. So you would kind of forget who you are and have hallucinations. Luckily that never happened to me, but I still feel like it clouded my brain. Like my sensory perception was really messed up. My sense of time was really off. So it was just not a pleasant experience. But luckily it wasn't exacerbated by nausea and vomiting. So I really just kind of felt like shit for obviously the whole time I was on the drug in the hospital, but then I would really only feel bad for about a day until I got my hydration infusion. So that wasn't as bad as it could have been. They did take me off doxorubicin. They explained to me that I could no longer take any more of it because it would start to become toxic to my heart. So I received the most doxorubicin you can possibly receive, I guess, for someone that is in my height and weight class. So that was why the last 2 sessions were only with ifosfamide. I would say the hardest thing about this was like the mental struggles, because of methotrexate. Having those 2 sessions back to back, I'm in the hospital for a week on methotrexate because I basically have to wait for it to flush out of my system. But when you are on methotrexate, you only get like a week break before you have to go into the hospital. So I had 3 sessions basically in a row, which was just awful because that was just a really trying time for me mentally, to go into the hospital for a week, be home, go back in for a week, be home for a week, and then have the penultimate session with ifosfamide. And there was just like the IPCC released that climate change report. The hospital was allowing like visiting hours, but my fiance and a lot of people that I knew were working a lot, so I couldn't really have people there as much as I would have liked. And it's not like ifosfamide and doxorubicin. When I'm on those, I just kind of like sleep through most of it. It goes by pretty fast. But with methotrexate, I was fully conscious the entire time. I didn't feel any kind of side effect or anything like that. So it was really just sitting there and waiting to go home for 6 to 7 days. And then halfway through this round of chemotherapy, the hospital cut the visiting hours back from 11 a.m. to 7 p.m. to 2 to 6 p.m., which made it very difficult for pretty much anyone I knew to come visit, because everybody gets off work at 5 in Maryland, and I was getting treated in D.C., so that was difficult. That was very difficult. Yeah. And then in terms of emergency visits, I thought I was going to make it through this entire thing with none, just because everything was going so well, but I was not so lucky. I had a minor nosebleed at around midnight that became very serious and lasted for about an hour, so I had to go to the ER. I didn't have to get a blood transfusion or anything, but they did give me some hydration and all that. So the last thing that kind of happened during this round of chemotherapy was I was in the process of scheduling something called a manipulation under anesthesia. So that is a surgical procedure where they put you under and basically bend the affected joint to try to like break up the scar tissue and enhance your flexion. So I scheduled that assuming that my chemotherapy regimen would go one way, and it wound up being totally different, so I had to reschedule it. And that was just very frustrating because, it was, I guess the easiest thing to compare it to was like the last month of high school, where you're at the finish line and you're just rushing and rushing and rushing to get there, but you just have to get through it and be patient and wait, and it just sucked. So here is a photo of my surgeon bending my knee to 120 degrees while I was under. As he explained it to me, the end goal for my knee is to only reach 90 degrees flexion, because while the metal that they put in me could certainly handle more than 90 degrees, the way that they reconstructed my leg probably cannot. So the fact that they were able to bend it that far really just benefited me in terms of what kind of flexion I would get once the manipulation was healed up, basically. So the other thing I'd like to take a moment to talk about in this video is kind of all of the prescription medication that I was on. I don't think people quite realize how much medication you have to go on when you get cancer. So here is a photo of everything that I had to take. When I first got sick, they prescribed me plenty of pain medication. So I had tramadol, oxycodone, morphine, the tramadol and the oxycodone. I switched to the oxycodone because the tramadol was not working very well. I had been on oxycodone and morphine before for my back surgery, and I hate both of them. They just stopped working for me after a while, and I don't want to up the dosage and wind up overdosing or anything like that. And they just they don't make me feel good, like mentally or anything like that. So in terms of pain medication, I was given tramadol, oxycodone, morphine. Eventually I started a pain medication for my nerve pain in my leg called gabapentin. That was working very well at first, but I feel like I don't really need it as much, so I did cut back on that a little bit. In terms of nausea medication, they gave me Zofran, and then they gave me two other drugs. One was called prochlorperazine and metoclopramide. The only one that really worked was metoclopramide, I feel like. And even then, my nausea would still come through during the first half of chemo, like I said. But I didn't take any of that during the second half. I didn't really need to, because I never felt nauseous. I think I threw up once, and I think it was just because of what I ate. And then they also prescribed me medication for my GERD, which is gastroesophageal reflux disorder, or esophageal reflux disorder, called pantoprazole. That's been working very well. I probably will stay on that one for good. And then they gave me Senecot for constipation from the opioids. And then I have my blood thinners, so I want to give special attention to those. The first blood thinner I was on was called Lovenox. That's what the needles you see on the left are. So I had to inject that into my stomach twice a day, every day, for about 4 months. I think it may have been closer to 6 months, actually. And then when they knew I was healed up from my surgery, I was allowed to switch to a pill-based blood thinner called Eliquis. So I'm still taking that. Eventually I will come off of it once my oncologist feels like I'm active enough on my leg. I still have some swelling in my leg. It still has some discoloration. So I don't know like how far along I am with that. So yeah, like I said, I just wanted to give kind of special attention to all of the medicine that you may have to take while you're on cancer. I'm sure there are cancers where you have to take a lot more. I know my grandfather, when he had prostate cancer, he was taking 24 pills a day. It never got that far for me, I don't think. But the last thing I want to talk about, obviously I had to have more scans done at the end of chemo. I just had those. I had a full body bone scan this past Friday and a CT scan of my chest this past Saturday. I have not received the official word from my doctor yet, so you know, anything could happen, but I did check the results on my chart online, and the bone scan was clear. There were no new tumors, nothing suggestive of metastatic disease, and the CT scan of my chest was also clear, so nothing, again, nothing suggestive of metastatic disease in my lungs. So as far as I know, this is hopefully over. You know, I'm filming this just after I read the chart for my CT scan, so I'm still kind of in a state of disbelief, mostly. And of course, I'm just waiting to hear, again, the official word from my doctor to confirm it. And then the last thing that needs to happen is I need to get my my Groshong catheter taken out. So I'm hoping that we'll do that soon. I don't know for sure when that will be. Like I said, I hope it's soon because I'm tired of it. And then once that's out, I just have to get those 2 scans again every 3 months for 2 years. And then I believe after that it's every 6 months for 5 years. And then once you make it through all that, if it never comes back, then you're considered cancer-free. So I'm just happy that I made it this far. I'm happy that, you know, it seems like it's over now. And at this point I just have to do physical therapy. I'll be making a video about that. I'm still doing it. And yeah, that's about it.